idea was to create a place where young people can learn to connect data science with lung research, the fields that are shaping the future of medicine. Now, it is really inspiring to see how this vision has grown from an idea to the real. So, today, I'm very happy to welcome the next generation of researchers here in Munich at the CPC-M.
We looked around Germany to see what courses are provided for bioinformatics and computational biology. We saw that no courses were offered specific for lung science. That's why we started DataLung.
DataLung is a research school for lung researchers to equip them with the skills to deal with the kind of the data-heavy research environment of tomorrow. And to do that properly, we divided 2 tracks. The bio track, focusing more on teaching people with a clinical and biological background the computational skills needed, and the CompuTrack for those with a numerical background who need to learn more about the biological as well as clinical context.
Across both tracks, participants learn core data science skills, from programming and data visualization to statistics, machine learning, and even deep learning.
When I started working with data from pulmonary hypertension patients, I actually didn't know anything about the lung. And now having the DataLung School, where I even learn more about it and the connection between heart and lung and the diseases, I actually know what I'm doing with the data is useful.
Especially the biotrack allows for clinically trained researchers or wet lab trained researchers to really get a head start on computational biology and currently apply computational methods in lung research. This is a unique concept that I've never seen anywhere else in research.
The DataLung School is a joint venture between the disease-spanning working group AIDT and the DZL Academy. The German Centers for Lung Research Academy is the umbrella training program of the German Centers for Lung Research, and it currently encompasses 736 trainees spread over all of the DZL campuses within Germany.
For the lung science training, we're tapping into resources here in Munich. The program offers a comprehensive overview of the lung's anatomy and physiology and a wide range of diseases that challenge respiratory health. And we're very fortunate, privileged really, to have such dedicated teaching faculty. Their expertise, commitment to education, and passion for lung science are what make these sessions come to life.
AI can help us to see patterns that humans may miss. I do believe no one can solve the lung problem alone, but together we can move much faster.